Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स नागपुर नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 1. What is the full form of ACTH? A. Adrenocorticotropic hormone. B. Angiotensin converting enzyme. C. Acetylcholine. D. Angiotensin converting hormone. Correct answer A. Adrenocorticotropic hormone. 2. Inhibin is secreted by A. Stroma. B. Leydig cells. C. Corpus luteum. D. Surface epithelium. Correct. Correct answer C. Corpus luteum. 3. Calorie intake of 1-year-old child. A. 1000 kilocalories. B. 800 kilocalories. C. 1200 kilocalories. D. 1500 kilocalories. Correct answer A. 1000 kilocalories. 4. The famous 14 principles of management was first defined by A. Elton Mayo. B. Adam Smith. C. Henry Fayol. D. James Watt. Correct answer C. Henry Fayol. 5. A nurse demonstrates caring, sincerity, empathy and trustworthiness. A. Ethical nurse-patient interaction. B. Emotional nurse-patient interaction. C. Legal nurse-patient interaction. D. Therapeutic nurse-patient interaction. Correct answer D. Therapeutic nurse-patient interaction. 6. Vaccines and toxoids produce A. Passive immunity. B. Acquired immunity. C. Active immunity. D. Natural immunity. Correct answer C. Active immunity. 7. A 45 days old infant development icterus and 2 days later symptoms and signs of acute liver failure appeared. Child was found to be B positive for HBsAg. The mother was also HBsAg carrier. The mother's hepatitis B serological profile is likely to be A. HBsAg and anti-HBAAB positive. B. Mother infected with mutant HBV. C. HBsAg positive only. D. HBsAg and AG positive. Correct answer D. HBsAg and AG positive. 8. Lactated Ringer's solution is contraindicated in A. Fluid lost as bile or diarrhea. B. Hypovolemia. C. Lactic acidosis. D. Burns. Correct answer C. Lactic acidosis. No. These agents decrease intestinal muscle tone to slow passage of feces. A. Hypertonic. B. Cathartics. C. Laxatives. D. Antidiarrheal opiate agents. Correct answer D. Antidiarrheal opiate agents. Thus, an infant is to receive thyroxine sodium 0.35 mg once a day orally. The medications is available in elixir from 0.25 to 5 milligrams per milliliter. How much elixir should the nurse administer? A. 1.4 milliliter. B. 1.0 milliliter. C. 2.4 milliliter. D. 1.3 milliliter. Correct answer A. 1.4 milliliters. 11. A 34-year-old woman complains about pain due to lower abdominal cramping. Urine HCG is positive and pelvic ultrasound reveals a 10-week intrauterine pregnancy. The patient states that she is not sure whether to keep the pregnancy. Which of the following is the most appropriate next step in management? A. Inform the patient's parents. B. Inform the patient's partner. C. Counsel the patient or refer to an appropriate counselor. D. Termination of pregnancy. Correct answer C. Counsel the patient or refer to an appropriate counselor. 12. Based on the knowledge of electroconvulsive treatment, the nurse explains to the student nurses that atropine is given before the treatment primarily to A. Minimize intestinal contractions. B. Decrease anxiety. C. Prevent aspiration. D. Increase body secretions. Correct answer C. Prevent aspiration. 13. Modifies ACT is not given frequently on routine practice because of A. Myocardial infarction. B. Non-availability of anesthetist. C. Osteoporosis. D. Respiratory difficulties. Correct answer B. Non-availability of anesthetist. 14. In depression there is deficiency of A. Acetylcholine. B. Dopamine. C. 5-HT. D. GABA. Correct answer C. 5-HT. 15. An acid-fast bacillus which is pathogenic. A. Bacillus pertussis. B. Cornbacterium diphtheria. C. Mycobacterium leprae. D. Salmonella typhi. Correct answer C. Mycobacterium leprae. 16. The spinal cord is made up of 7 cervical vertebrae, 5 lumbar vertebrae, 4 or 5 fused sacral vertebrae, 4 or 5 coccygeal vertebrae and how many thoracic vertebrae? A. 8. B. 5. C. 12. D. 10. Correct answer C. 12. 17. Which of the following means translating the message into verbal and nonverbal symbol to communicate the receiver? A. Feedback. B. Encoding. C. Decoding. D. Channel. Correct answer B. Encoding. 18. Eugenics means A. Genetic counseling. B. Improvement of genetic endowment. C. Genetic preventive measures. D. Improvement of environment. Correct answer B. Improvement of genetic endowment. 19. When using nonverbal communication in a nurse-client relationship, the nurse must be most aware of A. Ethnic background. B. The client's development level. C. Contradictions to the clients. D. Nervous hand movements. Correct answer D. Nervous hand movements. B's. How does audit differ from research? A. It is more likely to be applicable to nursing. B. It can be carried out on inanimate objects. C. It does not need as many people to collect the information. D. It does not increase our understanding of the topic itself or allow us to transfer the results to other situations. Correct answer C. It does not need as many people to collect the information. Aiims. Which of the following intervention demonstrate the nurse understand about the newborn's thermoregulatory ability? A. Placing the newborn under a radiant warmer. B. Suctioning with a bulb syringe. C. Obtaining an APGAR score. D. Inspecting the newborn's umbilical cord. Correct answer A. Placing the newborn under a radiant warmer. Bias. What is the most serious complication of meningitis in young children? A. Epilepsy. B. Peripheral circulatory collapse. C. Blindness. D. Communicating hydrocephalus. Correct answer D. Communicating hydrocephalus. 23. Additional defects associated with exstrophy of bladder is A. Imperforate rash. B. Congenital heart disease. C. Pubic bone malformation. D. Absence of one kidney. Correct answer C. Pubic bone malformation. 24. 7 is the normal pH of the A. Blood in the testicular vein. B. Fluid within a typical cell. C. Blood in the renal artery. D. Urine. Correct answer B. Fluid within a typical cell. 25. Causative organism of infectious mononucleosis is A. Toxoplasma. B. Cytomegalovirus. C. Epstein-Barr virus. D. Varicella zoster virus. करेक्ट आंसर सी एप्स्टाइन-बार वायरस। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।